and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad HEINECK, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Smile. Hi everyone, I'm Alex, physical therapist assistant.
I'm Mike, physical therapist assistant.
And this is the total hip replacement fitness program. Exercises 4 to 6 weeks after surgery.
You know, every video we start, I have my legs crossed.
I know, we
and I'm
shouldn't be doing
breaking these
that.
precautions.
Yep. 2 goals in this sequence here is, number 1, continue following your restrictions. You're not that 6 weeks plus out, so you probably still have your restrictions. Clarify with your surgeon if you need to.
The next step of this video is to progress your range of motion actively or passively, what's allowed within your restrictions again.
Yep.
We're also going to work on increasing your strength, your balance, and normalizing your walking pattern.
Yep. At this point, you should be feeling pretty good. Pain should be, much improved. You should be ready to get moving. So let's get moving.
Let's get moving.
The exercises, we have 9 of them today.
9, that's
All
a
right.
lot. So all these, we're recommending 10 reps. Some of them have holds, some of them do not. Start with 1 set. You can progress up to 3 sets as you feel comfortable. You do not have to do them all. Find which ones you need work on or what work for you. Some of them also might break your restrictions, so ask your doctor before doing them.
Yep.
'Kay.
When in doubt, find out. That's kind of cool.
Wow.
All right. So number 1 here, the knee glide, or this is called the FITGLIDE. Get both sides going. If you're going to do one side, might as well do both, right?
Yep.
Bob and Brad, FITGLIDE.
The FITGLIDE's better if you have a hip done because you can work both sides. The knee
Yep.
glide is more beneficial if you have a knee
Yep.
surgery or rehab of sorts.
And
but
again, I'm going cautious here. I just have it flat. I don't have it elevated one way or the other.
yeah,
So
his hips are staying pretty neutral. I mean,
Yep.
his knees might be a little higher in that chair, but it's not bad. At this
Yep.
point in time, the likelihood of you dislocating your hip doing this are pretty slim.
Yep. And if you don't have a knee glide or a FITGLIDE, just put a towel down on the floor, or maybe even your socks are slippery enough on a wood floor that you can just get the legs going back and forth.
Yeah.
All right.
Number 2 is ball or pillow squeezes. This is also adductor, ADD
Yep.
squeezes. So Alex has a ball. You can just buy a cheap playground ball, deflate it a little bit, a little
Ooh.
easier to squeeze.
I haven't worked those in a while.
If you don't have one, you can just put a pillow in between your legs
Yep.
and just try and squeeze the pillow. Obviously, Alex is going to have a little more range because the ball is bigger than this
Yep.
pillow. This is a little awkward for me. Honestly, it's pretty narrow.
Yep.
But squeeze them together, hold for 5 seconds,
Yep.
and release.
You're going to feel a lot of tension on your adductors. It works.
Yep, it's going to feel your inner groin muscle.
Yep.
So if you feel it there, that's good.
And you could even do it laying down with your knees up. You could put a pillow between your knees if you're that type of person.
Yep, you can
There
do it
you
laying
go.
down. Squeeze. Actually, that's a little easier for me.
And you had to lay down anyways, so.
Yeah, I need to take a nap.
All right, number 3, Mike's going to show you the side-lying clam shells.
Okay,
So-
I'm going to get my mic out of my pocket. So I don't
All right. This is a
Beat myself.
very important exercise. It really isolates the glute medius muscle, a muscle that is affected during surgery. You need to get it stronger.
So typically this is my surgery side as long as it's allowed by your doctor because you are rotating your hip internally and externally with it.
Yep.
At this point in time you should be okay, but you can clarify. So all we're doing is rotating out and
Yep.
back in. The most important thing, keep your hips
Neutral.
neutral.
Yep.
Dude, this is it. If I try to go more, I'm rotating
Yep.
my whole
Don't
pelvis.
roll your pelvis.
If you could see, my feet are pretty much staying where they are. They don't go anywhere.
Yep.
So
And
it's-
even if you're just raising up again 4 or 5 inches, start there.
Yep, just go there. That's
If
fine.
your pelvis rotates and you're trying to compensate, just start there. It'll get stronger. So
Yep, so make sure you keep a neutral spine going this way with this. Don't rotate your pelvis out.
Yep. All right, we're going to get into bridging. And
Bridging?
This is the bridge progression.
Can I drive on it?
Well, you can try. You can try.
Might hurt.
All right, so bridge progression, we're going to progress. Your arms are going to be the progression. So Mike's going to start with his arms right down by his sides. They're going to help balance him as he tightens his butt muscle, tightens his abdominals. Everything's going to be tight and still breathes at the same time.
So you're just basically thrusting your hip towards the ceiling. Most people know what a bridge
Yep.
is.
The thing to
Pretty
focus
common.
on is tightening your glutes. I mean, that's the key
Yep,
here.
so I'm squeezing my butt. I'm getting my abs engaged.
Yep.
You're
Yep.
going to feel it in your legs a bit.
Yep. So the first part is arms down, and then Mike's gonna the second progression is elbows bent, so a little less support on the arms. Do a few reps here, Mike.
And then you can hold these 3 to 5 seconds.
Yep.
If you're feeling tough later on, you can go up 10 seconds or more if
That's
you
right,
want, as
yep.
long as it doesn't hurt anything.
Good.
And then last progression.
Last
what are we doing?
progression, arms across the chest. So it's just stability of your hips. All right.
And we recommend, especially this early on, do both feet. Don't try to
No,
do
that's,
one leg.
That's too much.
Keep both feet down. So
Yep. Did you feel a difference between number 1 and number 3, the progression?
A little bit.
A little bit, sure. But if you had a hip replacement, I bet you would
Yeah,
feel a
you'd
lot of it.
notice a lot more.
One more, lay back
Wow.
down. Straight leg raise, number 5. This one you've seen before, probably in our other programs.
So
and
we're going to say my right leg is the one that had surgery.
Yep.
Left leg's going to be bent, whatever comfortable.
Yep,
So you're going to do quad set. So that means my leg is straight, toes are pointed towards the ceiling,
yep.
and we're going to lift up
Lift straight up.
and control it and go back down.
Notice how he keeps his leg straight the whole time. There's no lag or bend in his leg.
And if you're counting like how many seconds it actually takes me to go up and down, this is like 2, 1,000, 3,
Yep.
1,000, 4, 1,000, 5.
Yep, yep.
So you don't have to sit here and hold it like up here, and don't kick around like this. This isn't doing a whole
Yep.
lot.
Take a break between each repetition because
So
you're going to need it.
activate, lift up. You're going to feel it in your hip flexor,
Yep.
iliacus, and psoas major.
He's making it look easy. If you're just going a couple inches off the ground, that's fine too.
Yep, and make sure not to break your precautions. I mean, I'm not bending beyond 90. I'd have to like start going way up here to
Yep.
bend beyond 90.
All right, now you can sit up, Mike.
Okay.
All right, so I'm going to demonstrate, this is called hip hiking. Now, this one's kind of aimed towards normalizing your walking mechanics. So we're going to say this is my surgical leg, the left leg here. So I'm actually going to raise my non-surgical leg
Or
and
your
just,
good leg.
yep, or your good leg. And you're just getting weight, for a longer time through your leg. When you walk, you probably realize you're on one foot for longer than a second. So this is going to normalize your walking mechanics.
Yeah, early on, you're probably not liking to put as much weight through your surgical side because it hurts. So
Yep.
this makes you kind of work on it.
Yep.
Stand at a countertop, at a walker, have a cane behind a chair, whatever works for you.
And weight bearing builds bone, faster than normal. So
Bone density.
bone density. Okay. Thank you for the clarification.
Builds bones.
Well, basically.
You don't have
basic-
bones right now.
In a nutshell. All right. Standing exercises. There's 4 of these standing exercises. Before we start them, think of your precautions. One of these, if you have an anterior approach, you're not going to want to do
The back kicks,
the
hip
back kicks,
extension.
the hip extensions. So
If you have a posterior approach, you can march,
Yep.
but don't march too high.
not
Do
beyond 90, just
Yeah, don't go up there. Just do
up
small
to
ones.
90. Yep. So let's start with the mini squats. What do you say?
Okay, go ahead.
Okay. Mini squats. I think these were in the last phase too, weren't
Yep,
they?
they were
just
in the
started
last phase. Just do little sits. Do not bend too far
Yep.
because you would be bending beyond 90 in your hip range.
them. Yep.
So if you look at his hip right here and he's going down,
Don't go down here.
now he's past 90, but he's just doing little ones.
Yep.
Make sure to keep your heels on the ground. That's a good way to know you're doing correct form. Also try to look ahead. Don't stare at your feet or look at the ceiling.
Yep.
Just kind of look neutral.
Yep. Safety is the key here. All right. Hip abduction. So let's say this is my surgical side. We're kicking to the side.
I need a stick.
My toe is pointing straight forward. Sorry, I'm talking away from you.
So if you look at him, he's got a good neutral spine here too. Do a bad one once. See, he's leaning over and cheating.
Yep.
So focus on keeping your core straight and just kicking out. What was
Or this
that
is
one?
even bad too. I was showing the toes out. That's bad.
That's bad.
Yep.
Don't rotate.
Toes in.
Toes straight ahead. It's just a little range of motion. So you
Yep.
can do both sides.
Okay. And then let's do the calf toe raises. This one's great for balance. Your calves get sore, or they get weak. Your anterior tibialis gets weak. So
Did you mention that they can hold on to countertops or chairs too?
They should hold on to countertops and chairs.
Or walker.
Or walkers.
Or-
Yep.
If you have a large
Anything.
dog that is this tall.
Or your wife's shoulders when she's sitting there. If whatever you want to do.
Or your husband. What if it was a woman that had this done?
And then we talked about hip extension, kicking back. But this one, if
you
you have anterior approach, no.
Yeah, don't do this one.
But-
Eventually, your surgeon will let you know when you can start extending your hip
Yep.
again.
But
for
you don't
now-
want to lean forward when you're doing hip extensions. You want to stay upright.
Yep, see this
straight
whole
back.
neutral posture there.
What muscle is this working, Mike?
Your butt.
Glutes. Glute max. All right.
Professional terms.
Mike's gone. He's out of here.
See you later.
All right, number 8. We don't have it right here because it's kind of big and oxy to move. Stationary bike if it's available to you, but a couple things to watch out for is you want to,
Make sure your seat is higher up so you're not bending your hip past 90 when you're pedaling.
Yeah.
You can do the vertical style or recumbent style. They're both fine.
Yeah.
Just make sure your hip isn't flexing too much and breaking precautions.
Mm.
Also, start with the lowest resistance possible until you feel comfortable, and then work up from there. Also start with go low resistance for 2 to 3 minutes or 5 minutes, something easy. And then if you feel fine the next day, progress, go 6, 7, 10, 15, whatever. Progress time with duration, like if you can go 15, half an hour eventually way down the line,
Yeah.
but start low resistance and build that up as well.
in our next phase, we're going to get into some resistive training. So, and then number 9, ambulating, decide on your assisted device. If you aren't hobbling, you aren't having much pain, maybe now is the time, you can start weaning away from the walker, the cane, or the crutch, or whatever you're using.
A
So,
lot of people start indoors without it, short stuff in your
yeah,
house.
that's a good point.
Progress to when you're going outside on longer walks, stick with what you're using. You're gonna start fatiguing.
Right.
Even if shopping, at least bring a cane if you don't want to haul the walker around anymore and you're walking okay.
Yep. Yep.
Just don't. If you're doing that thing I showed in the other video where you're doing this still,
Yeah, the Trendelenburg.
it's too early. Do not ditch the assisted device. That's what it's there for, to prevent that.
Yep. You want to equal weight bearing on your legs when you walk. That hip hiking exercise we did, very important for your walking. So, all right, subscribe to us.
You can check out more videos related to the Total Hip Replacement Fitness Program on bobandbrad.com/programs.
Thank you.
Thanks.